my friends. This is Dr. Diana as patient, and I am pretty ill. I'm getting very close to starting our first clinical trial, although I'm trying to arrange to do a few simultaneously, if at all possible. Heaven knows we have a lot going on in our bodies, and traditional science dictates that we move in baby steps, treating each one of our comorbid conditions basically one at a time. This is a killer because it makes clinical trials vastly more expensive and slows us down so much. I'd like to help change this if possible, and I have a few ideas about how to do that. I don't want us suffering a day longer than necessary, so please keep your eyes peeled for the start of the clinical trials coming soon, okay? Now, meanwhile, today I'd like to discuss a topic that we're sometimes hesitant to bring forward, but we need to. That is depression and suicide ideation. One reason that many of us are hesitant to discuss this is because we can become labeled as depressed and treated as psych cases instead of as having a bodily illness. Am I right? Now, our fears are not unfounded. When doctors hear about depression and suicide ideation and can see little wrong with us because we have invisible illnesses, right? It's easy to jump to a psych diagnosis. I have no doubt that these chronic illnesses affect brain chemistry, no doubt at all. But it doesn't mean that doctors should dismiss our other symptoms, for it's by examining our other symptoms that we can find the answers. Now, it appears that people with invisible illnesses, including numerous autoimmune disorders, have a propensity for depression and suicide ideation. I think it's important to bring this forward and expose it to the world for what it is. It's a symptom of our chronic condition. As a symptom, suicide ideation and depression are nothing to be ashamed of. Okay, it's a symptom. I truly believe that only a small portion of the depression experienced is actually situational. I say that because when I first experienced it, the feelings didn't always line up with how my body was feeling. And the suicide ideation and depression would oftentimes start and stop as if someone flipped on and off a light switch. I knew we were dealing with brain chemistry. For example, I felt pain or I felt sick and tired. I've certainly felt pain or felt sick and tired before, pulled many an all-nighter in school, for example. I didn't get depressed because of it, no. After taking stock of my body, I decided that something chemical was affecting my brain. And indeed, when nothing changed in my body but the depression lifted suddenly, I knew that something changed with brain chemistry. Now, we need to take this seriously, and if you're having these feelings, it's important to reach out for help. But please remember, this is a symptom that I believe is reversible. Don't quit on me now. Not when we're about to start treatment trials, okay? We will get this symptom taken care of. And I'm speaking for all invisible illness patients: MS, EDS, dysautonomia, chronic Lyme, fibromyalgia, chronic fatigue, and likely rheumatoid arthritis and even lupus. Look at your symptoms. Can you see how the physical symptoms do not always line up with the psychological symptoms? This is a common theme in these invisible illnesses. I do believe we have a similar disturbance in our brain chemistry, and I believe it involves the same chemical in about 90% of us. Do not get me wrong. Once we've been sick for years and have lost so much, we have every right to be depressed and or suicidal. But I strongly do not believe this is the source of the symptom. Do you understand what I mean? I'm in no way diminishing the suffering that many of us must endure, and we can certainly suffer. Let me share some patient comments I've seen on Pretty Ill's forum and Facebook. This is from Mr. R. Quote, "I tried 3 times in 30 days to kill myself. I wrecked my bike, drove my truck into a tree, and for the finale, bought a cheap disposable car and took it the same day and wrecked it and was life flighted out to save my life. I was getting to the point I couldn't handle how hard it was to just be alive and try and just work. Every day I wanted to just drift off the road and put an end to the pain. I knew almost 2 years before anything happened that if this is what life was about, I just wanted out. But I knew I needed to be here for my kids. The worst part, I went in for some help sleeping and other dysautonomia problems, bladder and bowel. The doctor jumped to anxiety, and I haven't been able to live it down since." Anybody been there? Okay. This is from Mr. D. Quote, "You know, I am so tired of fighting with doctors. I am tired of being called a drug addict. I am tired of doctors not being able to diagnose a urinary infection from the symptoms. I am close to going out of business. I am all alone in this. I have been to the emergency rooms 2 times in a week, and they do nothing. I don't have a doctor again. I have no idea what to do. I don't have the strength to fight the system anymore. It's funny, I'm not suicidal, but I can think of nothing else to do at this point. At least that's legal. Do I really have to go down that road? So in prison, do you get free medical? My emotions are so all over the place. I cry and cry and cry. I just can't do it. See if I can make it past Christmas. If there is still no help, I guess I don't have a lot of choices. I really, really, really do not know what to do. There is not a soul here helping. God has left the building. I can't sleep because of the pain. Then I sleep 12 to 14 hours and can't get out of bed. Then I go to work and back home to bed, like Groundhog Day, except without the girl. Between the pain, exhaustion, and mania, interesting, that changes faster than the split personalities, interesting again. The counselor, when I was talking about it, asked if I needed to be locked in a hospital. She was serious. Is that how I get medical help? This world sucks, and it sucks a little more every day. So, who can relate? Not only do the struggles of those patients sound familiar, but who can relate to the depression and suicide ideation? I certainly experienced it, and it seems to come in waves. Interestingly, many of us can show a sort of bipolar presentation, and feelings of depression alternating with euphoria are not uncommon. Now, if this sounds like you, obviously get help from anyone. Just talking about it to someone who cares can make all the difference to you. Medication can help, but we all respond so differently to medication. We tend to be very sensitive. So start with a very small dose. I'd highly recommend that. Now, meanwhile, I am pushing ahead with these clinical trials as I believe I understand what is happening to our brain chemistry and why. Knowing this, we can treat it at its source, the first domino, as I've come to call it. As I push ahead with the clinical trials, please join us at the forum at prettyill.com, where we'll reach out to each other. This is why I created the forum. It's a safe gathering place for everyone, okay? So for everyone out there dealing with a change in brain chemistry and an invisible illness, please hang on. We are so close to getting this corrected. Don't quit on me now, okay? Okay. Big, gentle hugs to you all.